Bueno, hola a todos, bienvenidos a este webinar de FIFARMA, un
Good
webinar muy
morning,
importante sobre
everyone.
inteligencia
Welcome to
artificial y
this
Big Data,
FIFARMA
una
webinar
conversación súper
on
importante sobre cómo
artificial
está
intelligence and
revolucionando
big
la
data.
prevención,
A
el
very
diagnóstico y el manejo
important
de diabetes
conversation on
en
how
América
prevention,
Latina.
diagnosis, and management
Antes
of
de iniciar,
diabetes is
quiero
being revolutionized in
contarles
Latin
que
America. And before we
este
start, I
webinar
want to tell you
está
that this
con traducción
webinar
simultánea en
has
español, inglés y
simultaneous
portugués,
interpretation in
así que
English,
les quiero dar las
Spanish, and
indicaciones
Portuguese.
fáciles de
So
cómo
I want to give
acceder
you
a ella.
quick indications
En
on
la
how
pantalla
to
están viendo
access.
tres
On
pasos
screen, you're
básicos.
seeing
El
three
primero
basic
es en la
steps. The
parte
first one
inferior.
is at the
Van a encontrar
bottom.
un icono de un
You're going
loguito
to
que dice
find a globe
interpretación.
icon that
Entonces ahí
says
le pueden dar clic
interpretation.
y
There
luego
you
elegir
can
el
click
idioma
on
en
it,
el que
and then
ustedes se
you can
sientan más
choose
cómodos. Este
the
es en
language that
inglés,
you feel more
español o
comfortable in.
portugués.
You have
Y
English,
luego
Spanish, or
en la parte
Portuguese.
inferior
And
hay
then
un
at the
espacio que
bottom,
dice
we
silenciar el
have
audio original. Entonces ahí en
another
ese
space that
espacio
says
ustedes
mute
pueden
original
usar
audio. So with
el
that
idioma de
step,
su
you can
preferencia.
choose your
Y ahora
language of
para
preference.
empezar el
And
webinar
now to start
oficialmente,
with the
quiero darle
webinar
la bienvenida a
officially,
Janet Gija, directora de
I
Genética
want
de
to welcome
FIFARMA,
Janet Jiha,
para que hablemos un
Executive
poquito de
Director of
publicidad.
FIFARMA,
Así que
to
Janet,
open the
bienvenida
webinar.
y
So Janet,
bienvenidos a todos.
welcome and welcome
Muchas
everyone.
gracias, José.
Thank you so
Muy
much,
bienvenidos a
Jose.
todos. Como dijo José, mi nombre es Janet Gija, soy la directora
So,
ejecutiva de
as
FIFARMA,
Jose said, I'm
la
Janet
Federación
Jija. I am the
Latinoamericana
Executive
de
Director
Industria
of FIFARMA, the
Farmacéutica
Latin
e
American
Investigación en Salud.
Federation of
En
the
FIFARMA
Research and
creemos
Development
firmemente
sector of
que la
the
innovación en salud
pharmaceutical industry. And
debe
at
ser
FIFARMA, we
y debe
believe
ser
firmly
y
that
hacer parte
health
esencial de todos los
innovation has to be
esfuerzos
an
por mejorar la
essential part
calidad
in
de vida de
all
las
the
personas.
efforts to
Junto con la
improve
Academia
quality of
Nacional de
life of
Medicina
people.
de
And
México
together
hemos
with the
creado este
National Academy
espacio,
of
que es
Medicine of
un espacio
Mexico, we
único,
have created this
para
space that we
escuchar
consider
nuevas
is unique
soluciones que
to
contribuyan a
drive
mejores
new solutions
resultados
that
en salud.
contribute to better results in
Hoy
health.
más que nunca
Today, more
somos
than ever,
testigos de cómo la
we are
innovación avanza a un
witnesses
ritmo
of how
exponencial
innovation
en
moves
todos los
at
ámbitos
an
y la salud
exponential
sin
pace
duda no
in
es la
all scopes,
excepción.
and
La
health
inteligencia
is not the
artificial nos ha abierto
exception.
las puertas a
Artificial
una
intelligence
multitud de
has opened the doors
posibilidades y
to a
precisamente
universe of
hoy
possibilities,
tendremos la
and
oportunidad
today,
de escuchar
precisely,
al
we will have
profesor
the
Dennis
opportunity
Oswald,
to listen
CEO
to
del
Dr.
Instituto WIFO de
Dennis
Alemania,
Oswald, CEO
quien
of
nos
the
hablará
Weifer
cómo la
Institute in
inteligencia
Germany, who will
artificial y el
present
Big
how
Data
artificial
están transformando
intelligence
la
and big data
prevención
are
y
transforming
diagnóstico y el
prevention,
manejo de la
diagnosis,
diabetes en
and
América Latina.
management of
Luego,
diabetes
la
in Latin
sesión será
America.
clausurada por la
Then the
doctora Ana
session will
Carolina
be closed by
Sepúlveda,
Dr. Ana Carolina
vicepresidenta de la
Sepúlveda,
Academia
Vice
Nacional
President
de Medicina.
of the National Academy
Pero
of
antes de
Medicine.
adentrarnos en esta
But
conversación, que yo sé que
before
es una
we go into
conversación
this
muy importante,
conversation, that I am
¿vale? Que
sure will
seguramente
be a
nos dará
very important
elementos
conversation that
esenciales
will give us
hacia el futuro,
essential
quiero
elements towards the
impulsar la
future,
palabra a
I
Emily
am happy
Morris.
to hand the floor
Emily
to
es
Emily
directora
Morris. Emily is
general
the
de Sanofi para
director, the general
Latinoamérica
director of
y
Sanofi for
México.
Latin America
Y Emily
in
nos dará una
Mexico. And
introducción a
Emily
este
will be
tema que nos
giving us
acompaña
an
en el día de hoy.
introduction to this topic
Como
that
dijo
brings us
José, les
together here
recordamos a
today.
todos que tenemos
As
traducción
Jose
simultánea.
says,
Please,
we remind you
everyone,
that we have
if you're
simultaneous
joining right now,
interpretation.
please know that there simultaneous translation to Spanish, English, and Portuguese. Bienvenidos todos, que disfrutemos este
Welcome,
evento y que
everyone. Let's
podamos
enjoy this event, and I
recoger
hope we
insumos,
can gather
elementos,
inputs and
reflexiones hacia el
elements and
futuro. Gracias.
reflections towards the
Emily,
future.
please go
Thank you
ahead.
so much.
Good morning. Thank you again. First of all, thank you for the introduction. First of all, welcome everyone again. Good morning, everyone, and happy Friday. It's a pleasure to be here with all of you today. Let me start by thanking FIFARMA and the Academia Nacional de Medicina for hosting us today, and all of you for joining such a relevant event for Latin America. We're all aware, right? I mean, it's in everyday news and in our lives how artificial intelligence is transforming the world that we know, and Sanofi is no exception. In fact, we have made a very, very strong commitment and are doubling down in this area. AI and big data is already transforming how we work across our research and development platforms, our commercialization work, our clinical trials, and so much more. And it's enabling us to accelerate innovation, to enhance our decision making every day, and to ultimately improve patient outcomes faster. So I'm proud to say that Sanofi is an R&D driven AI powered biopharma company committed to improving people's lives. We're working incredibly hard on our ambition to become the first biopharma company that is actually powered by AI at scale, with the goal of really cutting in half the time from initial discovery to commercialization of our innovative treatments. And that would obviously have a significant impact on patient lives and accelerating innovation in Latin America and beyond. Today, we will together discover the transformative potential of AI and big data in our mission to better transform diabetes care in our region. And to do so, we could not think of a better speaker than Professor Dennis Oswald, who will share with us the results of this important regional study and really guide us into exploring how these game-changing tools can help us in our mission in healthcare. So without further ado, it's my pleasure to welcome Professor Oswald. The floor is yours. Thank you.
Thank you so much, Emily. It's a great pleasure to be here today. I think it's the first time again in Latin America since a couple of months, but I will return next week again. I hope you can hear me very good.
Yes, we can.
Super. Thank you so much for Sanofi for supporting us in this project about AI and big data revolutionizing diabetes prevention, diagnosis, and management in Latin America. I want to start, why is this so important? And I have good news from Germany, where I'm headquartered. For the first time, our new chancellor, Mr. Merz, announced that health isn't a cost, but we should see it as a sector. And in the past, we forget that this sector is growing faster than others, and this is a sector of prosperity. I'm really thrilled about this statement. It's openly available, and he understood what we, with partners, try to push ahead over the last years. But this is only the first step. The second step is what we also did together with FIFARMA, that we need to ask more, why should we invest in health? Why is it smart to invest in health? Because next to the economic footprint part, what we also did for selected Latin American countries, it's important to see, why do we need strong partners in the healthcare sector? Because we have future diseases which create a certain risk to societal prosperity. And we did the socioeconomic burden study. And just as an example, in Brazil, diabetes mellitus type 2 creates damage to GDP of 1.2%. In Mexico, it's 1.7%. And we need to think about how we can reduce this socioeconomic burden today, which will maybe increase in the future due to elderly societies or other effects. And now AI and big data comes into play. How can we use AI and big data to really optimize processes to create better health for the patients, even detect diabetes very early, and in the end, save money and reduce the risk of socioeconomic burden? I structured my presentation the following, so it will take around 30 minutes. First, it's all about definition and background. Then artificial intelligence. What kind of applications do we have in diabetes for the Latin American countries? Then I want to describe to you the economic footprint of AI applications, opportunities and also challenges. And a topic what we definitely shouldn't forget is the ethical and data privacy considerations, which we also need to address. And then in the end, policy implications. If we talk about artificial intelligence, first of all, we need to define it, right? Oh, sorry. We need to define it that it's kind of an umbrella of machine learning and deep learning, right? And big data means that in combination to it, that we are collecting big data and complexity data sets in the last years, which we need to deal with and which we need to use for certain purposes, like to fight against diabetes. What are the challenges in diabetes care? We have late diagnosis. Many people remain undiagnosed for years. It requires multidisciplinary care, limited healthcare capacities. Don't forget about this, especially at the primary care level. And patients must actively manage the disease. So this is a good hint why AI can help. Overall, this makes diabetes care complex and resource intensive, and then AI can play a crucial role. What can be the role of AI in diabetes care? AI can improve early diagnosis, help manage patients remotely, promote self-care via real-time data, reduce the need for in-person visits. And behind everything, it's resources which is affected. what we see that already now AI supports different aspects of diabetes care. So the prediction of diabetes, so there are AI algorithms use genetic and clinical data to make better assessments. We have the diagnosis of diabetes where we are using AI that they are facilitating earlier and more precise diagnosis of diabetes. And also in the management of diabetes, AI predicts upcoming episodes of hypoglycemia or other risk factors. And so we see there's already some ideas along the patient journey where AI is used, but this is only the starting point. If we are going deeper in these three dimensions, we have a current landscape in diabetes prevention and prediction. We have effective preventions in LATAM countries, hinges on public policy, population-level intervention, and behavior strategies. What the use of AI can do, the goal must be AI can predict who is likely to develop diabetes before symptoms appear. AI can leverage data from health records and variables to detect diabetes risks early. And the impact would be an early identification enables timely interventions, potentially reducing future diabetes incidences. Coming to diagnosis, the goal is that we can classify diabetes types, T1D, T2D, GD, etc., that we maybe have a better classification of diabetes supports personalized treatment and identification of higher complication risks. The impact could be enables non-invasive, cost-effective, and scalable screening using novel data sources, helps primary care settings lacking access to advanced lab tests, and supports personalized treatment planning. Last but not least, the management of diabetes goals. AI in diabetes, first, AI in diabetes health education, so we can create better understanding of diabetes. AI-based automatic diet monitoring provide tools for tracking food intake. So it's very, in a way, simple, but it has a huge impact. AI in personalized physical therapy for diabetes. AI in blood glucose monitoring and prediction, so that we use data from CGMs, variables, real-time better glycemic control and improved patient control. AI in drug therapy for diabetes, so that we optimize personalized anti-diabetic medication dosing, and this is also a huge impact to diverse patient scenarios. There are the current landscape in diabetic complication management. The goal must be to improve early detection and proactive management of diabetic complications, and that we use models, offer case estimations, and individualized risk calculations, enabling clinicians to initiate early interventions. And AI algorithms can do so, and we need to see and hope that this works. The impact would be, it would enable clinicians to prioritize intensive care for high-risk patients before complications progress. And there is an example that AI-based systems are used successfully in retinal imaging in primary care autonomously, aiming to a reduction of diabetic retinopathy and diabetic macular edema. And the FDA has already proved it, and the results are great. That a high-performing system with a sensitivity of 87.2% and a specificity of 90.7% in detecting more than mild cases. This is a great result of prevention of vision loss and achieved via early detection, timely referral. Here are some studies, and you will definitely we will share the presentation afterwards. Very recent publication from Argentina and Brazil. What is the economic dimension of AI? So we have, I already described, rising diabetes prevalences, limited sources, especially in financial terms. And yes, it's seen as a cost driver because we have late diagnosis, we have hospitalization, and specialist shortages. This is and these are the steps where AI can mitigate these through early detection and monitoring. How can we optimize AI-driven health systems? AI supports predictive analytics to forecast population-level trends. It wouldn't be able 10 years ago. It enables proactive planning for healthcare service and resource allocation. It guides facility-level decisions like staffing, bed allocation, and supply management. This improves system efficiency, readiness for demand surges, and budget optimization. How can AI impact cost reduction? So we already talked about fewer hospitalizations and complications. I don't want to get through all the points, but this reduces the need for emergency care, long hospital stays, advanced treatments. Then we have optimized treatment and resource use. This reduces the need for overuse and underuse of treatments, lab tests, and clinical visits. We have an efficient chronic disease monitoring. This automated digital monitoring reduces in-person appointments. This saves time for the provider and also reduces administrative costs while maintaining care and quality. And it reduced diagnostic errors, which is really a relevant point as well, because the diagnostic tools because we have diagnostic tools, and this AI-driven tools reduce misdiagnosis, delayed diagnosis, and cost related to advanced stage disease and poor outcomes. And last but not least, the preventive care and health management. This guides target cost-effective intervention rather than late-stage treatments. So you see there are a lot of impacts AI can deliver to reduce the cost in diabetes care. I like much more in the last years. I think it's even more important to think about the workforce in different countries in the world, and therefore we need to enhance the workflows so that we create efficient processes. And AI can increase productivity. Why do I mention this labor component? Because in some countries, especially in European countries, we are facing labor market shortages, and it's really an issue for the patients that we have not the right people to the right time at the right place. And faster decisions, examples are autonomous AI screening, automated monitoring with social diabetes apps, and AI-supported decision makers by predictive models and decision support and tools streamline workflows, enabling quicker, more accurate clinic decisions. There are some global case studies, so it's still a very new topic. I think we need to push it. We will talk about the challenges and also the opportunities, but it's in my opinion, the enabler to make the processes in diabetes much more efficient, and it will reduce healthcare costs over the next years. And this is important. And we can see here preventing disease progression will save up only for type 2 diabetes 25% of the costs, creates can reduce the cost by 25% and so save $3 million per 10,000 patients. That's a huge amount. Or enhancing screening efficiency, we can see that AI-based diabetic retinopathy screening demonstrate cost effectiveness with an incremental cost effectiveness ratio of $11,000 per QALY, well below the willingness to pay threshold, right? It's really or improving patient adherence as ProVC AI model improved adherence in high-risk diabetic patients by 50%, leading to an annual saving of around $2.2 thousand per patient. And the reduction in hospital readmissions, this can save money of approximately $250 million across 100 patients. So you see there are studies in place and brand new ones as well from Lopez Garcia et al. Who create evidence why it's important to use AI along the patient journey or the patient journey of a diabetes patient. But what are opportunities and challenges? Let's start with the opportunities. We have the opportunity due to precision medicines. We have, I don't want to read all the bullets, we can discuss later on. Penetration, so digital health tools can reach underserved or remote populations, and particularly useful for low-income or rural areas. And this is something where I see a great momentum. How can we create health equity and using AI in different regions? Prediction, yes, I did already discussed about it. AI predicts diabetes onset, diabetes complications, can identify early intervention for high-risk individuals. Personalization is also very important because it supports personalized health education, tailored diet and physical activity plans, adaptive blood glucose monitoring, individualized treatment regimes. So these are opportunities which we should take into account, and to overall, you can add to this, we have opportunity for collaboration, opportunity to enhance diversity and inclusion, opportunity to build long-term trust. Trust is a huge topic in AI. We can reduce risk and enhance resilience. And we have, and this is what we always always say, if you measure it, you can shape it. We can, with this data, shape future regulations. And for it's a collaboration, for shared value creation. These are the opportunities. But there are also challenges, and I don't want to hide them because it's a new field, especially in diabetes, but also in the entire healthcare sector. By the way, sometimes we should also keep an open eye how other sectors use it. Often we in our sector, we think that it's so complex and we can't use other approaches, and then we invent the wheel again and again and again. That's maybe in some topics not so important. So we have the challenge of data privacy and ethical concerns. How can we mitigate the strategies? Maybe develop federated and swarm learning models, strengthen cybersecurity measures, implement strict data anonymization and privacy safeguards. So there are ways, and I'm a person who know me. Yes, I like challenges, but I don't want to talk always about problems, but about solutions. And there are solutions if we take it serious and we take care, and we need to find ways to mitigate strategies to get rid of these challenges. We have the lack of clinical integration. How can we mitigate? We need to design AI tools that can be smoothly integrated in existing clinical workflows, that provide transparent, explainable AI outputs. And AI must be used to support, not replace clinical decision making, right? This is, as you know, everyone who is using AI right now, it's wonderful, increasing sorts and productivity and creating ideas, structuring problems. But in the end, you must be in the topic to find also the areas where AI is not on the level you may expect and you need. Now, a couple of more challenges. The bias in AI algorithms and poor data quality. We really need to understand that AI is collecting every single data point without taking the quality into account. And so there will be errors in the algorithm, because if you're putting bad input in there, then the output is bad. But there are also strategies how to find or to create to mitigate this aspect. You need to ensure representative data sets. You need to conduct regular bias audits. Specifically for Mexico, the following strategy has been proposed: addressing the problem through data protection laws and establishing a government-run public database. So there are ideas, and maybe other Latin American countries can use it as a blueprint, or use it as a first step in the right direction, which is tailor-made for them. Next challenge, the non-adherence. What can we do? Maybe smart and simple design that fits into users' daily lives. Using voice assistants or voice-enabled features to make interaction easier. And then the last challenge is the gaps in law. Questions are about liability in cases of medical error or malpractice. Not clear. It's unclear who is responsible when an AI tool contributes to a wrong diagnosis or poor outcome. But all this needs also to be solved, and then maybe with a definition of legal responsibilities. Develop robust regulations for AI in healthcare. This is a must in the future. And now coming back to the Latin American landscape, infrastructure challenges and global alignment. We analyze that LATAM countries face specific barriers: limited infrastructure, uneven digitalization, and disparities in healthcare access. However, and this is our hope, AI presents strategic advantages in overcoming these barriers through automatization, mobile deployment, and low resource adoption. Coming to the fifth chapter, ethics. This is really something, in my opinion, the most risk factor, in terms that someone says we don't want to get into AI even more. So, but we couldn't start an ethical discussion before having a feeling what AI can really realize. So we need to face the challenges, and we need to be prepared for ethical questions. And this is responsible AI isn't just about using smart technologies. It's about making smart, ethical decisions about how, when, and why we use it. So we need to clearly formulate where to use it, how, when, and why. And then we may face also this ethical discussion, this ethical discussion, because what is important? Balance is essential. Embrace AI's benefits while considering its risk. It's okay, but embrace AI's benefits. Ethical oversight is necessary. That means constantly consider ethical consequences for each application. Data privacy and ethical use. Prohibit applications if violates human rights and social values. Ethics by design is critical. ethical thinking should be into the entire AI process from development to deployment, not added on later. What looks like the regulation trends in Latin America and Mexico? If we see the landscape in Latin America, we see that they are developing national AI strategies. But overall, we see it's still very new and underdeveloped compared to other countries. New policies should be practical and tailored to Latin America's healthcare systems. To align innovation with regulation, in my opinion, Latin America needs both local, national regulations, a regional shared approach for AI. But it's hard. Different countries have different priorities and resources, and maybe there is an opportunity that they learn from each other and discuss how they may place AI together in the LATAM region. And this calls for diplomatic coordination and international cooperation. What are the policy implications in the end? So, regulatory frameworks must keep pace. That's one key implication. We have a need for flexible regulation that can evolve as AI tools are updated and retrained over time. We have transparency and explainability, what I already mentioned. So we need to place this idea or these tools in a proper way and it must be transparent and explainable. The data privacy and ethical use is a must for policymakers that must be ensured. And we need to think and discuss early on the concerns around bias, discrimination, and data ownership. That must be transparent and explainable. And we need interdisciplinary collaboration within the sector, within the sector, within the different stakeholders of the healthcare system, within the value chain of diabetes patients, and across the countries, so that we may learn from each other, because I think AI can help in diabetes in every single country, in every diabetes patient journey. That should be a goal. And the use of AI should be combined by equity and access and by clinical support. We need really to convince the clinicians that it makes sense to use AI, and policies must safeguard the clinical autonomy and judgment of healthcare professionals. AI is not replacing, but it's complementary if you use it smart. And it can improve equity and access, especially in underdeserved populations. So in my opinion, if we have the infrastructure and can help to create better health for all, and especially better health so for people who are not as privileged as others. What are my final reflection? We need to scale AI for impact in Latin America. We have a transformative potential and real-world impact. We can use better predictive analytics for public health planning. We can optimize our resource allocation, what I also mentioned before. And for me, AI in diabetes healthcare, especially in diabetes, is the path forward for it's a sustainable investment and will help so many patients and people. And coming to my first words in the beginning, it's a smart investment to invest in AI because it pays off. It will leave an economic footprint. It will leave a social impact, an impact to human capacity, a value to the society due to better health. And for me, most important, it will fight against increasing socioeconomic burden of diabetes, which amounts between 1.2 and 1.7% of Latin American countries' GDP. And this is thrilling. This is, oh no, it's shocking. Sorry, the wording. It's really shocking, and we need to start managing it. I was in Brazil, and I was invited to talk to the advisor of President Lula, and he mentioned, and I presented to him the FIFARMA study, and the result was that 1/3 of the cost of illnesses create a socioeconomic burden of 8.7% of the GDP. And then I told him, multiply it with 3, and then you are reaching a 1/3, or 1/4 of your wealth. And you're not even started to manage this problem in the future. That's key message. So my key takeaways, I already mentioned it. We need infrastructure, and we need to invest in infrastructure and digital disparity. AI can help to address systematic gaps in diabetes care. Most countries are in early stages. We need to scale AI in diabetes care. This requires not only technology, but also local adaptation, capacity building, and so on. And by connecting national strategies on leveraging local strengths, Latin America can shape a unified vision for AI in healthcare, and I hope we can support you on this. Thank you so much for your time, and looking forward to discussion.
Thank you very much, Dr. Oswald. Very interesting review of the AI use in diabetes. Thank you very much. I think it was very clear. We have 2 questions in the room. The first one is by Esteban Morales, and you addressed some of this before, but maybe you can give a little bit of more insight into the question. What ethical considerations we should have when using AI tools in diagnosis?
Excuse me, was it a question to me or?
Yes, it's a question to you.
Sorry, can you repeat it, because my computer is running out of energy, and I need to change to my mobile. But can you please repeat it? Sorry, once again.
Yes, you already addressed some of this, but maybe you can deepen on the answer. Esteban Morales asks you what ethical considerations we should have when using AI tools in diagnosis.
It's always a good, there are so many different aspects of ethical discussions. Can we force someone to share the data, as an example? Should we force someone, if we know AI can definitely find out which patients are at risk, and how do we get to use this data? Can we use this personal data? Shall we use this personal data? Shall we use only data which is anonymized? So these are ethical.
Yes, we are not listening to you. Okay, we can see
Sorry.
you. Yeah.
Sorry, I needed to change to the mobile. Can you see me? Hear me?
Yes.
Perfect. Did this answer your question?
Yeah, maybe you could talk some about the benefits of those people that share their data, or who participate in the databases for the diagnosis. So should they have a benefit?
Yeah, that's something what I'm curious about. We are sharing so much data, right, all over the place, and if it's coming up to health, we are skeptical. And this skepticism should be reduced. We are all wearing this wearables here, tracking the data, and why shouldn't we get use out of it, right? And if you would get earlier diagnosed by diabetes, then you can act earlier, then your survival rate will increase, the costs will be lower, and yeah, that's a win-win situation for everyone, for the society, for us, and for yourself.
Thank you very much. We have an anonymous question that says, what could be the impact in sustainability goals of using AI that consumes huge amount of resources?
Wow, wonderful question. Because yeah, we are dealing as Wi-Fi Institute also with impact analysis, where we analyze what is the impact on the environmental impact, the societal impact, and yes, we see that the using of AI is incredible energy intensive, right? And therefore we need to find ways as well. But I think that that with all the green energy and other aspects, there are solutions. Don't only want to see problems, but so it's a challenge, but there are solutions in place how to deal with it, that we have a green energy transformation.
Thank you very much. We have another question by Murad Said. Could you please share some best practices using AI to improve access to the best healthcare, close the gap, and get better outcomes to patients with diabetes?
Best practices. I mentioned some about the global. You have seen on the slide what are the global numbers, the global insights. And what I'm impressed of is really what I learned now in different European countries, how AI can help to reduce hospitalization and also the visit of the physicians. And this is something what it's time saving, it's cost saving, it's not, it's the same or even better quality. And this is for me one of the most impressive aspect that what AI can help in diabetes.
Thank you. So do you have, are you aware of any economic study that analyzes the impact of the adoption of AI on the cost for the system in reducing hospitalizations and improving healthcare for people with diabetes?
Unfortunately not, but we are trying to work on this, because I think this would be really a game changer also in politics, right? I mentioned in the beginning that some now see health as a smart investment with growth rates, but on the same level, the same people you need to convince, why is it smart to invest in AI in diabetes? And this must be monetized in GDP categories. So like, look here, 1.7 damage in GDP terms in Mexico. If you introduce AI in the first 3 years, you will reduce it by 1.5 percentage points of GDP, and multiply the 0.2 with the GDP, then you have a billion value. And I think we need this kind of evidence to steer or to give political decision makers an idea what to do, right? And I think that AI has a high, very, very high impact to a lot of other innovation we are facing now.
Okay, so what are your insights about using AI and portable wearables for healthcare, and the increase in the gap for good and bad healthcare for people with and without the resource?
You mean what are the incentives for people who are using it or not using it, or can?
No,
what
about deepening the gap between those who have access to wearables and digital health systems, in contrast with those who do not have access to these mechanisms that use AI for taking care of their healthcare.
Yeah.
So that
Okay, I
would
understood.
fill in the
Understood.
gap.
That's maybe one of the most sad points. All over the world, we see that people are, with lower income have lower life expectancy, right? And now, if you are richer, and then you are taking care more, usually you're carrying more care of your wealth, then you are thinking about buying variables, using this data, and then you improve your health. And so I see also as really a risk that the equity gap gets broader, not closer, right? Because and this must be also on the radar of policymakers, that they think about how do they manage this, right? If they don't manage it smart, it can be the case that we have even a higher gap between within our society.
Yes, indeed, that's something that keeps us thinking in Mexico. So finally, the final question would be, what would be the main regulatory barriers that you see in the laws in the different countries, especially in Mexico?
It's always the same. First of all, there must be a willingness to do so, right? And the willingness must be not only on the level of the Minister of Health. It must be, I would say, AI must be placed in all policies. Investing in AI in healthcare and in diabetes must be promoted everywhere. And only then there will be a momentum. And this is what I learned, especially in Latin America. You need to create narratives for different policy areas. Why shouldn't a minister of labor, and so I don't know if you have one in Mexico, sorry about this, but why should he support the idea to invest in AI in healthcare? There are a lot of arguments, productivity gains. So there are a lot of different aspects you need to digest. But why should the president be keen on investing in AI? Yes, because or the Minister of Treasury, because there is an opportunity to reduce the socioeconomic burden from 1.7% to 1.3, 1.2, and we save up money. More, if we save money, we have better growth, more productivity, more growth, and with more growth, more fiscal space. And this is what I like. Maybe this is a good moment to raise this aspect. We need to explain that investments in health, investments in AI, investments in AI in diabetes are innovation, and we need to spark innovation in product, processes, and systems. If we really spark this innovation and we can point out what does this mean for better health, and better health means more productivity. More productivity creates greater GDP. Greater GDP creates more fiscal space. And then more fiscal space can partly reinvest it. And this I call the positive feedback loop of health investments. And I think this must be in the mind of political decision makers, so that they act together. And then the regulatory stakeholders will find solutions.
Thank you very much. I'm taking some notes. So I will make a final conclusion of the today's very interesting discussion. First of all, AI is all around us, and we should not be afraid to use it positively in healthcare. That would be one of the first bullets. The second one would be that we should promote its use not only in diabetes, but also in all the other diseases, because it will give a positive feedback to the system in terms of health and in terms of productivity. Governments should implement routes to implement AI, not only in health, also in everyday life, in all of their in all of the country's life. And AI will not substitute doctors. AI will complement our work, and we should be smart to use it in our own advantage. Maybe that would be some of the conclusions. Would you like to complement something?
No, the only remark is have use also the impact. It will have a huge impact in economic terms, in societal terms, productivity, what you mentioned, and in reduction the socioeconomic burden in the future. Because the last point is, in my opinion, why our chancellor understood that health is a sector and it's smart to invest in, because we need to manage future socioeconomic burden. This is a risk for the prosperity of countries, and leaders of countries, they need to secure economic growth in the future, right? And if everyone is ill or not a healthy fast enough, then we are facing major problems, and this is key to think about.
Thank you very much, Dennis. I don't know if somebody from FIFARMA will close the session. If not, we would like to thank you and all the audience in Spanish and in English for taking this webinar. We les damos las gracias de la Academia Nacional de Medicina de México y FIFARMA.
From the National Academy of Medicine of Mexico and FIFARMA, we thank you for your attention.
Thank you so much for having me. All the best. Have a great day and a lovely weekend.
Thank you very much.
Bye-bye.